There are two primary reasons behind that. The first being that even though we are not yet up to what we really expected in terms of vaccinations, but still we made significant progress on that front. So we have been able to vaccinate a significant portion of the adult population. So that's one part of the story that led to the decline or relative decline, I would say. We are still have ways to go. But the other part of the story is that we actually have a really high level of infection that has not been detected. So what that means is that the people with some level of immunity, either through vaccination or through recovery from getting infected, whether actually getting tested or not, is actually very high. So we are actually close to about 90% with the population, adult population, who have immunity by one of these two methods. So what that means is that the risk pool is shrinking one way or the other.
That is
And
interesting.
that is the primary reason behind that.
Yeah, sorry to interject. So you're really talking about what, that herd immunity concept that some countries had thought was going to be possible down the track.
That's correct. So we are actually pretty close to herd immunity in US in the conventional sense of the term. We probably would have already reached there if it would not be for Delta variant, which is more infectious than the other earlier variants, because previously we estimated that once like close to 90% of the people reach some form of immunity, we will get there. But now I think it's in the 90s, so we are not there yet, but we are somewhat close. But one thing to keep in mind is that the immunity that we are getting is not permanent. It probably will not disappear completely, but it will slowly wear out. So that's something that we will really need to be very careful about.
You're still seeing alarming levels of infections despite that drop-off.
That's correct. That's correct. Exactly. So essentially now the transmission is mostly through the unvaccinated population, but hopefully even that risk pool will keep shrinking either by more infection or maybe some vaccination. Although we have to say that a big chunk of the population through which the infection is kind of going on right now is the school-going children under 12. So we are hopeful that the vaccine will be approved for them as well, maybe in another month or so. So that probably would lead to another drop in the new COVID cases.
So when we're looking at this broad drop-off, though, there are states like the one that you're in, Texas, where there is strong resistance to mask mandates and vaccines. Does that show a different picture?
Texas is pretty much following the same trend of the nationwide data. So we are also having the same level of decline that you just mentioned earlier for the nationwide data. So we are seeing pretty much the same trend. And you pointed correctly about the resistance to mask mandate and vaccines. But what that means is that the people who are not complying, they are getting infected at a higher rate, and maybe most of them are recovering. So even in that case, even though we are having had a large number of cases and hospitalizations, but in the long run, the cases will keep declining. We probably will see some bumps again from the holiday travel and socialization, like we have Thanksgiving holidays, Christmas coming up. So that probably will give rise to some increase, but till spring, what we are projecting that we are going to see a steady decline overall. But beyond that, we don't really know, because we still don't know how long we stay immune from vaccines or from infection.
Yeah, and this is, as in Australia, where we've treated things very differently, but we are coming to this phase where we are going to try and live with the virus within the community through vaccinations. So what are the statistics showing you about the seriousness of the illness for those people who are getting that, particularly in the unvaccinated?
Well, right now what we're seeing is that close to 95% of the seriously ill patients in hospitals and also in ICU beds from COVID are the ones who are unvaccinated. So we have clear data that vaccines are very effective in kind of lowering the risk by a large amount. Vaccine is not something that's like a bulletproof shield in the sense that you have zero risk of infection. That's not the case, but your risk gets significantly lower. And even if you get infected, chances that you have a serious medical condition is very low.
That story doesn't change. Is there any sense that you're getting that the virus is retreating at all?
Well, as I said, I mean, the numbers tell us, at least in US, of course, in Australia, the story is different. But in US, we are seeing a slow but steady decline. And we expect that to continue until spring. And that's simply because of the fact that the risk pool is shrinking. Like even if people don't follow the safe guidelines, it will linger longer. So the decline will be slower, but still we expect to see a steady but slow but steady decline.
Yes, but not necessarily any weakening in the virus itself. That's fascinating. Rajesh, thank you so much.
My pleasure.